Good afternoon, and thank you so much for joining us here at UCLA. Welcome to the Center for Reproductive Sciences, Health, and Education Distinguished Lecture Series. I'm Tracy Johnson. I'm the Dean of Life Sciences. I'm a faculty member in the Department of Molecular Cell and Developmental Biology. And the division, I'll say a little bit more about who we are before I get into the exciting reason why we're all here. The Division of Life Sciences really encompasses what I think are some of the most important aspects of what happens on this campus. We have the Department of Ecology and Evolutionary Biology, Microbiology, Immunology, Molecular Genetics, Molecular Cell Developmental Biology, Psychology, Integrative Biology and Physiology, and the Institute for Society and Genetics. And so as you can see, we cover a vast array of research enterprises on this campus. We have a very simple philosophy. The Division of Life Sciences is committed to educating the next generation of scientific leaders and advancing scientific research in pursuit of life-changing discoveries, solving society's most pressing problems, and improving the lives of the planet, of everyone on the planet and the planet itself. So it's a noble mission. We think we have the right people to achieve it, and we're excited to tell you about some of the things we're doing to approach that in the Center for Reproductive Science, Health, and Education. So what we do here at UCLA in the Life Science, we do not do in isolation. We believe that the best science and the best research happens in collaboration across disciplines and engaging many units, as well as Los Angeles, the entire Los Angeles ecosystem, our partners across the city. We think that that's where the most important work happens. The UCLA Center for Reproductive Science, Health, and Education is a beautiful example of this because the center is dedicated to bringing together students, scientists, educators, physicians, and community members across a wide range of disciplines to support the research and education initiatives that are designed to improve human reproductive health, promote healthy families, and advance the well-being of society. So while the center is led, obviously, in the Division of Life Sciences here at UCLA, the center operates in partnership with the David Geffen School of Medicine, the UCLA Johnson Comprehensive Cancer Center, the Institute for Society of Genetics, and the Eli and Edith Broad Center for Regenerative Medicine and Stem Cell Research at UCLA. So today's special event marks the inaugural, it is the inaugural event marking the opening of the center, and that's the center's Distinguished Speaker Series. The division is honored to have many in attendance who are partners in supporting the center's mission of advancing the work around reproductive science. So first I'd like to start by thanking our Executive Vice Chancellor and Provost, Darnell Hunt. I'd also like to acknowledge my colleagues here who have supported the center: Ron Brookmeyer, Dean of the Fielding School of Public Health; Jessica Gibson, Director of the UCLA Bixby Center to Advance Sexual and Reproductive Health, Equity, and Health Equity; and Professor and Fred H. Bixby Endowed Chair on Population and Reproductive Health; Steve Dubinet, who's the Dean of the David Geffen School of Medicine; Russell Korobkin, Dean of the UCLA School of Law; and Abel Valenzuela, Dean of Social Sciences. And I thank all of these leaders for their partnership with the center. I'd also like to thank our special guests. Thank you, Supervisor Holly Mitchell, UC Regent Elaine Batchelor, and Kristen Schlater from LA Care Health Plan for joining us for this important discussion on Black maternal health and care in Los Angeles. So thank you so much for being here with us. So in the past several years, there's been a lot of discussion that has been based on politics and perceptions and ideas around reproductive health. I don't think we need to go into much detail to have very clear and recent examples of that. In fact, far too little of the discussion has really been centered on science. And that's where we would like to make a difference, because science really is the foundation of health, and policy professionals should be able to use science to make rational decisions that are important and impactful, that will affect the lives of women and the entire society. So the time has really arrived for an internationally recognized center that is really focused on research and education and innovation in the reproductive sciences, such that decisions can really be driven by science. Recognizing the importance of reproductive science to human health and well-being, UCLA has established this new Center for Reproductive Science, Health, and Education to serve as a unique national and international home for research training, career development, and public outreach. Our commitment to education, of course, is always at the forefront of what we do. So the center is also the home for innovation in educational programs that we think will change the landscape of education for our students here at UCLA, but students beyond. Another core principle of our division is the importance and our commitment to diversity, equity, and inclusion. So we believe and we know and we are committed to the idea that the best science and the best research happens when it addresses the needs of a diverse population and when it's carried out by a diverse community of scholars. And so it's with that philosophy that the center is really embedding itself in really important conversations that affect individuals across a wide spectrum of diversity. So today, I think, is a beautiful example of that, because we're going to kick off this discussion by focusing on something that is near and dear to my heart, Black maternal health and care. So it's my pleasure to introduce the center's director, Dr. Amanda Clark. And this is especially, it's special for me because she's one of my colleagues in my department. And so I've had the honor of watching her as a scholar and a leader for many years. Dr. Clark is a stem cell scientist, a geneticist, and a developmental biologist who's internationally recognized for her work on the germline and in vitro gametogenesis. Dr. Clark is a professor in the Department of Molecular Cell and Developmental Biology, and she's the inaugural director of the Center for Reproductive Science, Health, and Education here at UCLA. She is the president-elect of the International Society for Stem Cell Research, which is a global nonprofit that promotes excellence in stem cell science and its applications to human health. Dr. Clark's lab has become famous for using stem cells and regenerative medicine to understand the science of human reproduction and fertility. Dr. Clark's work has been recognized by many awards from international societies, especially for her work in stem cell research. Some of these awards are from the organization Stop Cancer, the Lance Armstrong Foundation, and the Concern Foundation, and she was recently awarded the Founders Medal from the Australian and New Zealand Society for Reproductive Biology. So I would just like to, before I turn it over to Dr. Clark, I would like to thank all of you for being here today. I'm excited that we're going to be in conversation about a topic that's so important with people who are across our community here at UCLA, students, staff, faculty, researchers, but most importantly, we're engaging with our community so that we can really think deeply about this important set of questions. So with that, I'd like to turn it over to Dr. Clark.
Thank you, Tracy. Thank you, everybody, for being here today. I'd like to begin by thanking the staff of the CRSHE who put this event on, in particular Stephanie Kiso-Ido, who is the Associate Director of the CRSHE, as well as Stacey Antonou, Assistant to the Director, and Brian Rupke, our Chief Administrative Officer. I'd also like to thank Olivia Lum and her team, as well as our sponsors and partners, who you can find at the back of your program and who are on display as you were coming in the room earlier today. I would also like to acknowledge the support of my co-director, Professor Hannah Landecker from Sociology and ISG, and join Dean Johnson in welcoming our Executive Vice Chancellor and Provost, Darnell Hunt. Thank you so much for being here. In 2021, Dean Johnson and I discussed the critical importance of creating a new centre focused on evidence-based research and education in reproductive health and care. Our goal for this centre was to kickstart new opportunities for research on the UCLA campus and to create space for conversations about reproductive health and equity. In the summer of 2022, the vision became urgent as the Dobbs-Jackson decision of the Supreme Court revealed general gaps in the general public's knowledge and understanding of reproductive bodies and also how reproductive bodies are cared for. And the realization to us that this lack of understanding actually extended to undergraduate students in higher education, not just on the UCLA campus, but a gap in the programming for reproductive health and science as a part of undergraduate education. To be part of the solution, our centre created 4 priority areas: to increase the visibility of reproductive sciences and health research on the UCLA campus and to work towards more inclusive practices for research in this area. To better prepare our student body for evidence-based conversations around the importance of reproductive health, science, and care. And to familiarize students to the reproductive health care workforce and the critical responsibility that they have in ensuring that this care is evidence-based and equitable. And finally, our 4th activity is to create the Distinguished Speaker Series in order to learn from people performing transformative work that impacts reproductive health and care through research, policy, or education. And that is why we are here today. I'm a scientist, so I actually need to show a little piece of data. So here is the data that I want you to take a look at as I talk you through it. For our first Distinguished Speaker event, the focus is on Black maternal health, and specifically how health policy, community engagement, and education can improve outcomes. This is the research that shows disparities in outcomes for Black birthing persons in California. So this data comes from the California Department of Public Health, and in particular the Maternal Child Adolescent Health Division. So it's not that disparities in outcomes for Black birthing persons is a different state's responsibility. It's all of our responsibility. And this disparity is also seen in the state of California, where there is some of the most permissive and inclusive policies for reproductive health and care. So you can see this disparity, which is displaying pregnancy-related mortality ratio in different racial groups from 2012 to 2020. So this increasing disparity in Black maternal health outcomes is not just a one-off. It happened in one year, it didn't happen again. This is a structural problem that we need to solve together. So finally, the most important thing behind these statistics is that there are real people and real families. Today, our goal is to hear from the people at the heart of making change to improve the lives of Black women and their infants and their families. So thank you. With that, we're going to start the official side of the program. So I would like to introduce Kristen Schlater, who manages maternal health education programs for LA Care Health Plan. Before Kristen starts, I'm going to talk a little bit about what LA Health Care Plan is for those of you in the audience who have not heard of this before. LA Care Health Plan provides access to quality health care for LA County's most vulnerable and low-income communities. The agency was founded in 1997 and today provides health coverage and community services for more than 2.9 million LA County residents. The organization is also a strong supporter of the David Geffen School of Medicine at UCLA, providing full-ride scholarships each year to 8 medical students. And they've been doing this for the last 5 years, and as far as I'm aware, they're continuing to do it into the future. So we are delighted that Kristen is here to tell us about LA Care's community education work in Black maternal health. So please join me in welcoming Kristen.
Thank you so much, everyone. And we at LA Care are delighted to be here today and to sponsor today's program. And as Amanda Clark, she gave a great overview of LA Care and what we are about and what we offer. But I'll just add a little bit to that, and I'll keep my remarks brief so we can all listen to our speaker that we have here today. So we also have several different departments at LA Care that are dedicated to reducing maternal health disparities as well as health inequities overall. We have our Health Equity Department, we have our Quality Improvement Department, we have Health Education Department, where we all sync up and align goals to further reduce disparities among African Americans as well as LA County's populations overall. We are committed to finding and creating solutions and advance health equity and include our goals and to reach those goals among partnering with community-based organizations. We can't do this alone, so we have to partner community-based organizations that also help us along our journey to reduce those disparities. We're most excited and happy about the new doula benefit that launched this year. So the doula benefit, yes, thank you, launched January 1, 2023, and we are just coming upon the anniversary of this benefit. And doulas provide educational, physical, and mental and emotional support for women and birthing people to guide them along their pregnancy journey. So with that, we are so excited that we have this benefit to offer to all of our pregnant members and birthing people. And we've gotten a pretty good start. We've gotten very good feedback regarding this benefit, and we're very happy to offer it at LA Care to our Medi-Cal members. We are also looking forward to expanding partnerships. We can't do this alone. We look forward to working with hospitals, schools, community-based organizations to help us along the journey. Again, our goal is definitely to reduce health disparities and inequities. And I'll keep my remarks short, and thank you for having us here.
One of our first sessions to our undergraduate students in talking about who was part of a care team for birthing people, doulas. And we were actually quite surprised that many of our students didn't know what a doula was. And you'll hear a little bit more about doulas today in the remarks, so stay tuned for that. So next, I would like to introduce Elaine Batchelor. Dr. Batchelor is the Chief Executive Officer of MLK Community Healthcare. Throughout her career, Dr. Batchelor's priority has been to improve access and quality of care for underserved communities through innovation and collaboration. Her awards and recognitions are numerous, including a James Irvine Foundation Leadership Award and the Partners in Care Vision and Excellence in Healthcare Leadership Award. Dr. Batchelor is a rheumatologist by training and a graduate of Harvard University, Case Western Reserve University, and I am delighted to say, a Bruin, earning her MPH at the UCLA Fielding School of Public Health. In 2019, Dr. Batchelor was elected to the National Academy of Medicine, and in 2023, she was appointed a regent of the University of California. I've asked Dr. Batchelor to say a few words about Black maternal health and care, and to introduce Supervisor Mitchell for the UCLA Center for Reproductive Science, Health and Education Distinguished Speaker Series. Thank you, Dr. Batchelor.
Thank you, Amanda, and thank you for inviting me to this special event today. It's great to be here today, both as a Bruin and as a regent. And thank you for asking me to introduce my friend, Supervisor Holly Mitchell. Oh, okay, great. We're surprising her. My connection with Supervisor Mitchell goes back more years than either of us probably care to acknowledge, to a time when we were both younger, less tested, and as we noted and were discussing outside the hall, had fewer gray hairs. Even then, as she began her career at the Western Center on Law and Poverty, fighting for Californians experiencing poverty, and before she entered the world of government leadership, I knew that Holly was special. Since then, our careers have intersected and overlapped, and I have watched, cheered, and admired as she has taken on challenge after challenge. As a board member, I had the honor of working with Holly when she led Crystal Stairs, fighting for low-income families across Los Angeles County. Today, as the CEO of MLK Community Healthcare, I have the privilege of working with her to ensure availability of high-quality health care for her constituents in South Los Angeles. Advocacy is the through line in Supervisor Mitchell's career, focused on prevention of poverty and increasing access to resources for women, children, and families. She distinguished herself for a decade in the California legislature, passing 90 bills and serving as the first African-American chair of the Senate Budget and Fiscal Review Committee. She is distinguished now, yes, that's quite an accomplishment. She was doing some work in the legislature. She's distinguished now as a member of the first all-women-led Board of Supervisors in the history of Los Angeles County, an accomplishment that all of us women should take great pride in. We've benefited from Supervisor Mitchell's leadership and advocacy of MLK Community Healthcare. As I've known Holly in friendship and admiration over many years, I've come to appreciate her greatest asset. Holly is a champion. It's her nature. But she's a particular kind of champion, not just an achiever, but a champion centered on the words with and for. Holly does things with and for others. The Holly Mitchell I'm introducing is both advocate and partner, inclusive and fierce on behalf of all women. We are so fortunate to have her among us. Please join me in welcoming my friend, Supervisor Holly Mitchell.
That's a lovely, pleasant surprise when it is a sincere, people say, oh, we've been friends for years, and sometimes it's not true. Well, this is true. And so thank you, Elaine. As she was talking about that, I had a vision of a photo. Our mothers knew each other. Our mothers, who have both passed, were forces of nature. Yeah, right. They were, yes. And I have an image of a picture of in my mother's backyard in a hot tub. And Elaine's mother was there, and I was there, and they were having a drinking, laughing, good time. So that goes to show you that we really do go back in a real personal way. So thank you, Elaine. I appreciate you. And I appreciate being here and appreciate knowing the university is engaged in this very thoughtful, deliberate conversation that it is my hope will guide policy discussions. How many of you are students? Just by a sign of hand. Oh, show of hands. Okay, great. I had the privilege of starting my day today at Dickerson Elementary and Middle School in Compton. Dickerson is a school of Black and brown students, 650, and they do TK through 8th grade. And as I sat here listening to the introductions and what's happening here on this prestigious campus, I have to say I thought, how many of those students will find their way here? How many? I hope it will be a significant number because the exercise we engaged in included me asking them to answer three questions. Let me see if I can remember. It was basically what makes them feel safe in their community, what they felt their community was missing. There were 3, I only remember 2. And their answers were profound. Both filled me with hope and made me deeply sad about what they felt was missing from their community. And sometimes when young children have fundamental
basic assets missing from their community, they hit a ceiling very early in life. So I hope that our collective work, my colleagues on the board and I, working very hard every day, can pour assets into their community so they find their way a very relatively short distance to this amazing institution. My why. I ask myself that question, ask my team members that question on a regular basis because it governs my work. You heard through Elaine's beautiful introduction kind of where I've been professionally. What she didn't talk about was, I think, kind of the history of my why, how I got here, which was my parents were met as eligibility workers working for Department of Social Services then. And as a result of that, I realized not too many years ago that in my very early formative years, all the adults in my family either worked for the county or they were on the county, meaning they were beneficiaries or recipients of county services. And what's unique about that is in my early understanding of that, there was no distinction. My parents, who were initially social workers, my mother went on to probation and a career in corrections. Both of my parents, their entire careers working for the public, working for the state of California or LA County. And I think that has informed the way in which I have chosen to show up in the space of being an agent of government, be it an assembly member, a senator, or a county supervisor. And I see my role as bringing government to people as opposed to expecting them to navigate systems and find their way to us, as well as making government meet their current emergent need, as opposed to saying, well, this is the way we've always done it, and folks will just have to find their way to us. So my why. There are women here from Black Women for Wellness, a community-based agency. Its founder and I worked together many years ago in the California Black Women's Health Project, and it was during my time working around the likes of Billy Avery, the founder of the National Black Women's Health Project, where we were doing advocacy at the national level, that I began to look at the data impacting Black women's health and our lives. And the fact that the Black maternal morbidity rate and the Black infant mortality morbidity rate has in some decades worsened, but certainly hasn't improved significantly, is a part of my why. The fact that Black women are continuing in the state, which is now I think the 4th largest economy in the world, in a county with the, I think, 11th largest economy in the world, has a scenario where Black women are dying during or shortly after childbirth is criminal. And so my why is to figure out, much like my early experience with my parents, what role I can play in facilitating county government to address that challenge head on. Because it's not like some of the challenges we all face in society where we don't have the answers or we don't have the resources or our high hands are tied behind our back, we can't figure it out. We absolutely can. It is a problem we can solve for, and many are. At Martin Luther King Community Hospital, a program operating at UCLA Harbor, a county facility, with a program that they're running. So it can be solved for us. So the question we all have to ask ourselves is, and so why isn't it? And what are the barriers that are preventing us from addressing that morally offensive reality? That there are groups of women, all but for the color of their skin, who are on par socioeconomically in terms of educational attainment with other groups of women who have poorer health outcomes and poorer birth outcomes compared to other women. So that's my why in terms of why I have lost my mind and left a job that I love that was much simpler, ran for public office, and continue to run for public office to attempt to create spaces and opportunities and policies to address those issues. Going back to once I was elected, my state level work and my ongoing advocacy with organizations I respect and have worked for over the years, we came to the table and introduced the bill, Senate Bill 464, the California Dignity in Pregnancy and Childbirth Act, which was controversial. It was enacted in 2019, and the law mandates provider training in hospitals on implicit bias to really require that child care providers check themselves. We all have bias, and to deny that is sophomoric at best. And so to go through the process of unpacking our bias so we are able to show up and do our work to the degree that we can as human beings, bias-free, I think is important when you look at the statistics on what's happening to certain groups of women. What I have found as a policymaker is you can fight the battles, lose your front teeth, get scratched and, have to take off your earrings and really swing. The bill is passed, the governor signs it into law, and then the work really begins to make sure that the law is actually operationalized. Well, it pays to have friends in high places. I served with the Attorney General when he was in the Assembly. So when we had a conversation about what's happening with the bill, when advocacy groups were saying, well, it didn't have any teeth in it, I was no longer in the legislature, I said, well, go back and introduce another bill that does. We at least got the first step through. Keep going. And so before we did that, he, in working with Black Women for Wellness and others, did a little homework and sent letters to all California facilities, healthcare facilities where children are born, requesting data on their implicit bias training of employees. And of the 242 responding facilities, 83%, that would be 201, had not completed, and in some cases hadn't even begun training until after receiving the letter from the Department of Justice. Well, again, it pays to have friends in high places, because after they got that first letter, July of 2022, when the investigation concluded, more than 80% of the perinatal care staff in the 242 facilities had completed their training. Funny how that happens, right? Because they knew that the Department of Justice was watching and was going to hold them accountable to the letter of the law, which I think we all should fully expect. We have more work to do, but for me, that was a first real concrete step in terms of drawing a line in the sand, saying it's unacceptable, and we're looking to the provider community to step up and do more. I was thrilled when the governor and my former colleagues in the legislature acknowledged the value of doulas, and doing so by including them as a Medi-Cal benefit. Again, making sure that all women, regardless of one's ability to pay, can have access to doula services. So I was thrilled about that. Again, how do we operationalize it? So at the county, we realized, being a Medi-Cal provider is no easy task. And that doulas, many of whom operate as individuals, may not have the back of the house capacity to have a clinic or a hospital with an entire billing department who does nothing but chase down payments for services rendered. And so we wanted to set up what we're calling the doula hub in the county to really provide support services to doulas, to continue to advocate on their behalf, because while it's great to be a Medi-Cal provider, we all know, particularly Dr. Batchelor, that Medi-Cal reimbursement rates aren't the best in the state of California. We wanted to make sure that we were providing support to doulas, to recruit and train more doulas. In fact, that's my retirement plan when I term out of Board of Supervisors. Have I told you? I'm going to be a doula. I'm coming. We wanted to really make sure that we didn't miss the opportunity, that Medi-Cal beneficiaries could fully have the opportunity to have this amazing service, because all the research shows us, as to go back to where my conversation started in terms of Black women and their experience delivering babies in the state of California, when doulas are involved, their outcomes improve significantly. Why? Because the doula's job is to pay attention to the birthing person, to listen to her, to believe her, to advocate for her. And so I'm really excited about what we're doing. We just had a meeting with all the health plans to talk about what they were all doing to step up to support this, that we wanted them to help us support the doula hub at the county. And I opened that meeting. It was last Friday. And I told them, y'all are in trouble having a meeting with me Friday late afternoon, because most days I'm sick and tired of being sick and tired, but on Friday I really am. And, you know, that this was a problem we could solve for, and I fully expected that all of us on that Zoom screen were going to do all we could to deliver. So now, you know, how are they going to say, no, Supervisor Mitchell, we're not? So I'm very hopeful and excited about what we heard from many of the plans, LA Care included, in terms of what they've already done and what kind of vision we share in terms of what we can build. Because if we build it in LA County, the rest of the state will follow. And so I'm excited about that very tangible next step we're taking around supporting birthing outcomes. Reproductive rights. Woo! Elections matter, just saying. And I was, you know, I have really been very fortunate and blessed my entire elected career to be in the right place at the right time. Sometimes to be proactive in terms of taking advantage of opportunities to expand access to policy. And sometimes it's like, really, am I the lone person standing? Case in point, can't remember the year I was in the assembly, and I brought forward the only bill in a state legislature in the entire country that advanced access to reproductive justice. Every other bill that went before a state legislature that year took steps back. And what's so tragic about that distinction for me is it wasn't like this supersonic change in the whole world kind of reproductive rights bill. It was simply a bill that said that if you were a nurse practitioner, you could administer a reproductive contraception, thank you, of choice. Not that you'd write the script, but just that you could administer. Like, and when Planned Parenthood brought it to me, I'm like, is this like a real thing? Like, this really can't happen? And so they talked to me about, you know, particularly in rural California, where Planned Parenthood or any reproductive health clinic may have multiple clinics. They may have one physician that goes to multiple clinics, and it's the nurse practitioner that runs things in their absence. And so if I don't happen to be in the clinic on Tuesday when the doctor is there, then I have to come back in a week to pick up my prescription that I had the script for. And as my grandmother would say, if you thought you might get pregnant on Monday, if you gonna wait a whole week. Right, that part. So, really innocuous bill from my perspective, and that was the only bill that advanced access to reproductive health services and choice and care that particular year in the entire country. So again, here I am at the Board of Supervisors, right time, right place, when Roe v. Wade is overturned. Made me think back to my very early days in my early 20s when I served on the board of directors of the Planned Parenthood Marmonte clinic in Sacramento. When I talked about how we had to change our language, because I was from a generation of young women who were post Roe v. Wade. I mean, we attained our reproductive maturity post Roe. And so when I had board members that were wearing coat hangers on their lapels, I said, you have to understand that really doesn't speak to me, right? That we have to figure out how to grow and groom and activate a new generation of activists to protect this right. And here, 30 years later, we've basically lost it at the federal level. So I was very proud in 2022 to carry a motion that was unanimously approved by my colleagues to make sure that LA County would be deemed a, quote, safe haven for reproductive health care, and to make sure that the county was appropriately resourced, because we knew, and it has come to fruition, that women from neighboring states would come here for a safe haven. My longtime friend and colleague, then State Senator Sidney Kamlager Dove, who is now a member of Congress, introduced a Senate bill, SB 1245, to allocate $20 million in state funding to fuse into this program. Again, it's good to have friends in high places, because policy without resources is a bright idea. Policy fused with resources affects change. So I was very proud to be able to do that, and know that there's lots more we have to do until we can regain my right to my own damn uterus. In the meantime, I think it's important that we continue to look at policy areas where we can provide protections when we can. And we're all very fortunate to be Californians, a state that chose to include in its state's constitution my right to my uterus. Sorry for our friends, family, and neighbors who don't call California home. I just think in closing, a couple things. Figuring out ways wherever we are, university campuses, students, nonprofit advocacy organizations, elected officials, how we can operate in our own lane to continue to elevate these issues, to tell the truth, to acknowledge the data for what it is, to check our own bias, and to create safe spaces where people can access health services that I believe they should be entitled to, and health services that are not only culturally and linguistically appropriate in how they're administered, but also see me for who I am and believe me when I tell you that something is wrong with my body. That's the ultimate goal. And all of us, particularly you all as students, have a unique role to play, and I hope that your long, illustrious careers in health are informed by that basic core commitment, in terms of your commitment to make sure that you see the patient for who they are, and listen and bring your bias-free attitudes to that service. So I'm continuing to operate in my own lane by bringing forward motions, allocating resources, supporting projects like Mama's Neighborhood. It's an organization formed at the Harbor UCLA Medical Center in my district, where it's a free, high-quality health care and support program for at-risk pregnant women before and after childbirth, where we do the full complement of wraparound services. We ask critical questions like, how can we be of service? How do we reduce stress? Do you need WIC, nutritional supports, housing assistance if necessary, breastfeeding education, parenting classes, all the things you need to make sure that you are in the best position to provide a wonderful opportunity for your baby. County was blessed to receive just under $4 million federal grant to support this program, and I'm hoping that we can look at pilots like that pop up at other county facilities. Martin Luther King Community Hospital is doing amazing work. Dr. Batchelor and I were featured in a movie. What's the name of the movie?
Birthing Justice?
Birthing Justice. Birthing Justice. If you haven't seen it, try to check it out, where they feature the work of Martin Luther King Community Hospital. They feature the work of the members of Congress who are trying to pass the Momnibus package of bills. They talk to me about 464 and other work. And so I'm really proud of all of those efforts, and yet we have so more to do. So in closing, you know, I have a portrait of Shirley Chisholm that hangs in my office. It was gifted to me by a Senate fellow, who's my last fellow before I left the state Senate, who's now at Cal in their School of Public Policy, getting an advanced degree. And, you know, when I think about Ms. Chisholm, for those of you who are too young to perhaps know, and this the final day of Black History Month, she was the first Black woman elected to Congress, representing New York, ran for president in 1972, and started as a teacher's aide, started her career there. But, you know, for me, is an example of a woman who had the courage and, frankly, the audacity to grab opportunities that were available for her in her time and to accomplish extraordinary things. She didn't let other people limit her expectation or define her. There's a movie coming out soon, and I hope it talks about how she was a founding member of NOW, National Organization for Women, and how the Democratic Party and NOW basically abandoned her when she decided she was going to run for president. And yet she didn't let that stop her. It was a courageous feat. And it wasn't about her being selfish. It was about her truly being selfless and wanting to create space for a broader conversation that needed to happen during that time on the national political front. And now is a time when we need people to take courageous stands and not perhaps the easier path or the safest path, but to really be courageous, to be selfless in our efforts to create a better LA County for all of us, an LA County where we can grow old in dignity and their children can grow and thrive. You know, I want an LA County, particularly in the 2nd Supervisorial District, where we no longer talk about deserts, food deserts, housing insecurity, healthcare access deserts. There's a young organizer in the Central Valley that gave me a beautiful analogy that I use all the time. He talks about, you know, we like to say underserved communities. He refers to them instead as unfinished communities. Because we all want to live in a community that's finished. What's a finished community? A community like some of the students this morning at Dickerson Elementary talked about. Communities that have resources, grocery stores that are convenient, tree canopy, green space. Every finished community should have schools that meet the unique needs of every parent's children. Every community should have a variety of housing options to meet our needs, be they single-family homes or multifamily dwellings. Communities with housing where I feel safe and seen and a part of, right? That's what a finished community looks like. And so I am working every day in my lane to make sure that every community in the 2nd District is a finished community. Because I think when we use those other terms to describe communities or groups of people, it puts the onus on them that they've done something or that they should be held accountable for the conditions in which they live. I am clear that sometimes government has fallen short, sometimes the general economy has fallen short and left some communities behind. So I hope that you all will make a commitment, as I have, to work very hard to finish communities. And in the context of what you're studying and what we're here to talk about today, that includes communities of women who have the right to determine their own reproductive justice and path, and that every group of women and girls have access to the services they need to meet their own needs. I really appreciate you inviting me today. It's been a delight. Help me with the next steps. Can I open it up for questions? Should I sit down? I'm going to go over here and sit down. Fabulous. Thank you.
So I thought there was going to be microphones. We're loud enough.
I can use my outside voice,
We're
yes.
loud enough women. Apparently there are microphones coming. Well, we can be loud enough for now. Megan, thank you. So maybe I don't need the microphone. So you're both alumni of a UC. So I'm going to begin by asking you today, what was your favorite class at UC? At a UC. I know you've been to number places.
Dirty 30. Dirty 30. Human biology.
Great answer.
That was so long ago, I don't remember my favorite class. But Dirty 30 was interesting.
I'm going to call my next class Dirty 30. Elaine, what about you?
Okay, so I'm an alum of the School of Public Health, and I have to say that I loved every class I took, and I still have these like worn out, tattered notebooks that I'm still hanging on to for some reason. But my favorite class was Introduction to Health System Organization and Financing. That was taught by one of my wonderful mentors and dear friends, Dr. Paul Torrance.
Beautiful, beautiful. Okay, I was being facetious with Dirty 30, but it was, the textbooks were very intriguing. I'm a poli-sci major. I attended UC Riverside. California politics was fascinating to me. And to then, move into California politics, and to, have to govern under the rules of a Jess Unruh, an early speaker of the California legislature that I learned about, was fascinating to me.
So we know from research that diet as well as exercise and not smoking is really important in order to reduce disparities in birth outcomes. So what are you doing policy-wise in order to improve access to food in communities that are low-resourced in LA County?
Our unfinished communities. So much. It was tragic to join the Board of Supervisors during COVID for so many reasons. But what has struck me, the county, as many levels of government, transitioned into food giveaways at a level that we had not done before, and worked collaboratively with restaurants that were closed that stepped up to help us at the city, restaurants that were closed stepped up to help us with the senior nutrition programs because the senior day centers were closed. And to see the number of people that would show up in the 2nd District for our food giveaways, the number of people who continue to show up in that we, generally believe that we are post-pandemic, in that schools have reopened, we're all gathered here together, the eviction moratorium has ended. From all indicators, one would suggest, based on decisions the government has made, we're post-COVID, and yet people are still showing up at tragically high numbers. So some of the work I'm doing specifically in the 2nd District, is, forging public-private partnerships to create opportunities for grocery stores to come in and finish communities. We have an amazing development along the Vermont corridor that was a strip mall that burned during the 92 uprising. And it was a parcel of land that was never developed. My predecessor, then Supervisor Mark Ridley Thomas, through eminent domain, which is a controversial power of government, seized the property. And when I say seized the property, the county paid for it to the tune of $40 million. We paid one amount, the owner sued us, went back to court, lost, we paid a different amount. So the tune of $40 million paid to buy this parcel, which is now being developed for a school, low-income housing development, and a Target. And South LA Cafe. So working in creative and innovative ways to bring options to finished communities. And this one is so particularly profound for me when I think about all that community was promised and was never delivered for all of those years that parcel laid bare, which was a constant reminder every time you drove past it about promises not kept. And so I think there are creative ways that government, again, can get out of our own way sometime to partner with private enterprise to bring developments to finished communities.
And at MLK Community Healthcare, what type of education initiatives are you aware of in order to have health promoting factors, particularly for women and their families?
And the
Elaine?
farmers market. We help.
Yep. So I'm going to start by saying that it's not just maintaining a healthy weight that contributes to good birth outcomes. It's maintaining good health in general that maintains good outcomes for pregnant women. And I think that all of the efforts to improve access to primary care and prevention and to keep women in optimal health as they contemplate getting pregnant and do become pregnant is very important. As a provider, we are in the community with health education. We are screening our patients for food insecurity, helping to connect them with the resources that Supervisor Mitchell just talked about. We also have our own food program that we call Recipes for Health that provides fresh produce, cooking classes, shopping lessons, et cetera, for patients that we're caring for. And, I think the education also starts at a young age, so having connections with schools, starting in kindergarten, all the way through high school, and connecting with kids and teaching kids about the importance of good nutrition and good health. I think all of that builds.
Can I comment on that? The reason I talked about bringing the resource to the community, a lifetime ago when I was the executive director of the California Black Women's Health Project, the State Department of Health Services, and I just saw this cookbook, so they're still producing it, produced a couple cookbooks. How to cook healthy soul food. How to cook healthy Spanish food, right? Right. And we were running, the Black Women's Health Project then was in partnership with UCLA, and we were running sister circles. And I brought the nutritionist in from the Department of Health Services, and she was doing the cooking demonstration. And you always have a group in the audience who's looking at you like, So I had two who lived in the building where we had the Well was our Black Women's Health Project office, and we were in the first floor of a housing development on 49th and Central. And I had a couple in the building who would come, and I'm like, they're only coming to make me feel bad, right? So they would always sit in the front row. And so she did her cooking demonstration. And we're going to prepare skinless chicken breasts, and she was chipper, and we're going to cook healthy soul food. And Miss Jones, I'm like, oh, here she goes. I said, Miss Mitchell? Yes, Miss Jones. I'd be happy to take this cookbook and cook skinless chicken breasts if you can find one for me in a market in South Los Angeles. And that started us on a project and a journey where we, could not find skinless chicken breasts. I learned about the point sometimes of colored lighting in meat counters, because it looks one way, then you pull it out from that colored light and it looks different. I learned about the routing system of trucks, and that, you know, the produce market is almost a stone's throw from 49th and Central, but their routing takes them west and north. And by the time they came back around to the markets around 49th and Central was days later. And, you know, you'd be challenged to find a leafy green anything that they were pulling off those trucks to stock in those markets. So finishing communities, making those communities priority, giving them healthy food options from which to choose, from a public policy perspective, is in my lane. And Ms. Jones taught me that 35 years ago.
You know, Holly, one thing I was going to add is, you know, the importance of being a role model as well. You know, so one of the priorities that we set when we developed our health system and opened was that we would only serve healthy food. And we had quite a debate and a, you know, almost a fist fight over whether we were going to have a fryer at the hospital. And, you know, certain members of my staff told me, you can't open a restaurant in South LA without a fryer. But I said, no, we will not. And we will also not have, you know, a whole bunch of sugary beverages and other, you know, huge donuts and cookies and things. And we've stuck to that. And we've stuck to the healthy food. And we have stuff in our cafeteria that even I wouldn't eat. Exactly.
That's leadership.
So, Supervisor Mitchell, while you take a sip of water, I'm curious about how you became aware of doulas, and how they and how that particular group of care providers can really help women during the birthing process.
So I was an adult before I learned why I was named Holly. Holly was my father's grandmother, who was a nurse midwife in Mississippi. And my father, have I already told you the story? I don't know. I was an adult. And I said, well, why? He said, well, as a very young child, they would be sent from East St. Louis, Illinois, to Mississippi to grandma's for the summer. And she was tall, 6 feet. I'm 6 feet. And he was deeply impacted by the fact that she had her own horse and buggy, and that white men would tip their hat to her when they passed her on the street, and that she wasn't required to step aside and off the sidewalk if white men passed her. Why? Because she delivered everybody's baby in this little small town in Mississippi. And for whatever reason, as a young child, he knew that was significant and admired her as a result of it, and said if he ever had a daughter, he would name her Holly. Now, the irony for me is I was an adult. I had already been leading the California Black Women's Health Project. I'd already worked for Diane Watson, was her health policy advocate. I'd already worked in reproductive health policy before I heard that story. So I just thought it speaks to me.
It was meant to be.
It was meant to be, because Grandmother Holly said so. And so just in my work early on with Black Women's Health Project, advocating on behalf of the needs of Black women, that I learned of doulas. I was on the board of the Birthing Project when I was a young staffer in Sacramento, developed by a former public health employee of the state, who looked at and couldn't figure out, you know, why the Black infant mortality rates were just disproportionately high in some counties across the state. And Sacramento County was kind of at the top of the list, and came up with this, you know, kind of innovative approach, much like midwives, much like doulas, where you're pairing a woman with a pregnant woman. And in the Birthing Project experience, it was it was a woman experiencing at-risk pregnancy, either a teen or a woman in jail, to just help her navigate the system. Not to be a mentor, but a sister friend, because you're a mentor, and a sister will give you two different kinds of advice. And the sister friend concept was to really empower her to help direct her to resources, but to power her to make decisions. And our goal was to make sure this young woman didn't have a second pregnancy within 1 year. That was the goal. And so those combined kind of experiences exposed me to the concept of doulas, where again, it's more non-medical than anything, but it's truly supporting the needs of the woman pre and postpartum, not just looking at the delivery as the soup to nuts of the experience, but leading up and months, if not the full year after, to provide her ongoing support. So those combined experiences exposed me to the concept of doulas and just all the data that shows us the role they play in improving birth outcomes and survival outcomes for women.
So Elaine, how do we bring in the doulas into the medical community so they're accepted as part of their care team? So what are the strategies we should be thinking about?
Great question. We don't necessarily do things in medicine just because it makes sense.
Or in politics.
So I would say, one, it starts with continuing to accumulate strong scientific evidence that doulas contribute to better birth outcomes, disseminating that evidence so that providers are familiar with it and understand it. I would say that providing adequate coverage and payment for maternal health care so that we have the resources to include doulas in the healthcare team. And then finally, I would say we need to make sure that we're training, and inviting enough women to become doulas so that they are available to our providers to deploy. And, I will say that we do work with doulas at my health system, either doulas that women bring with them, or if they don't have a doula, we have a way of connecting with them with that resource as well.
So we are at the hour. In fact, we're a little bit after the hour. And so there would be time for perhaps one or two audience questions, and then we need to close for the day. Do we have any questions from the audience?
First, I want to just say thank you. This was a really wonderful conversation. And I'm struck by a statistic about Black women in the birthing process, that when we correct for socioeconomics and access to care and all of the other things that seem like they're going to be really key factors, you correct for all of that, there's still a disproportionate risk for Black women. I was wondering if you could say something about what that's all about, and maybe what can we do to start thinking about systemic issues that we can get
It's
to.
about race. That's the common thread. And when we carried SB 464, I never remember the entity that did the research study. It blocks. But there was a survey of medical students, their survey of their attitudes toward Black women. And the perception that we have a higher threshold for pain, that our skin is more difficult to penetrate. I mean, the bias, that's the origin of the bill. The level of misinformation and bias, and I shall go further and say racism, took my breath away. The common thread is race. The common thread, the same can be said in terms of the statistics around Black infant mortality. When you adjust for access to early prenatal care, access to income, education, the common thread is race and the stress that is associated with being a Black woman in America. The extra burden society puts on us. It's the stress. So that's the common thread. That's the common thread that we need to call out and attempt to correct for.
I couldn't agree with her more. It is race and racism, bias, whatever you want to call it. I spent my Christmas vacation doing research and working on a writing assignment for a report that is going to be published by the National Academy of Medicine in September. It is an update of a report that was first published in 2003 called Unequal Treatment. You know, we were debating the name we should give the report. I like the name Still Unequal. And, you know, I spent some time doing research on just what we're talking about. Bias, racism. And, you know, that's it in a nutshell. You know, I will share the fact that there was a very large study done in the state of Florida that looked at all of the births in that state over a period of time, thousands of births, and compared outcomes for Black children who were treated by white pediatricians and children who were treated by Black pediatricians. The children who were treated by Black pediatricians had a significantly higher chance of surviving. And the association became stronger as the children became sicker. So, you know, I think it's wonderful for us to do bias training, but I personally believe we need to diversify the healthcare workforce, and we need to have a workforce that is aligned with the population. And, you know, once we get there, I think we will see a lot of these biases and disparities disappear.
I couldn't agree, and I'm going to say something a little controversial. Even with a diversified workforce, we need to do bias training. Because, I won't say that, but I think we have to do it, Elaine. If any of you have never taken the very easy online
I agree with you, Holly.
tests, the Harvard, yes,
Yeah,
or
we
there's
all
so
have them.
many available, to take them to just get in touch with your own sense of bias. I think it's a really powerful exercise that we should all do. You don't have to share your results. It's just important that you know and try to unpack for yourself how you got here. We did a racial justice learning exchange training at Cal State Dominguez Hills last night, and the focus was implicit bias in the media. Recognizing the role images, either in the news or entertainment media, play in informing and validating and exacerbating our sense of bias. And so I agree with you, because I was going to come back and say, you know, your example, when I have heard from the women who have delivered in your amazing program that combines doulas and midwives and doctors in a hospital setting, that costs extra because everybody's there and available, but cost shouldn't be our only determining factor. When I've heard those stories, it makes perfect sense that they feel seen and heard and validated. And there's not a question in their mind that the person attending them isn't fighting as hard as she is to protect her and have her birthing experience be productive. So I think we have to do both. We have to diversify the field, and we have to do implicit bias testing and training, and not just one, and then you're cured. Oh, yes, I'm not biased anymore. But that it's an ongoing part. It has to start clearly in the medical schools, based on that survey I saw. It needs to start as early as possible, and we have to continue to have the conversations.
And for those of you who are future researchers, I will take it a step further and say that we also need to continue to do research on the best ways to train people so that the training is actually effective and not what I would call performative.
So we have a few more questions from the audience.
Oh, I can speak loudly too.
Oh.
It would be remiss not to ask this question, especially for the Center for Reproductive Science and Health Education. But speaking as a UC Regent and as an LA County Supervisor, what policies and protections will you put in place regarding IVF? I can go home now. Just curious.
Yeah, it doesn't, when you invite your next person who's a state legislator or a federal policymaker, I think it's more appropriate there. Now, I guess I will go back to try to figure out what policies are in place at county health facilities. I don't know. But in terms of guiding and protection and restrictive policies or expansion policies, I think that's probably at the state and federal level. That doesn't fall in my lane.
And I think as long as it's, legal, we will provide those technologies and treatments and continue to advance the science at the University of California.
All right. Thank you. So please join me in thanking Supervisor Holly Mitchell and Dr. Elaine Batchelor. We're so grateful that you brought the community to us, but it's our job to go out into the community. And so with that, thank you so much for coming, and there's a reception outside.